More than 3 billion global citizens are at risk of malaria epidemic, creating public health emergencies to more than 100 countries, which could have impact on population health and on different countries' economic development. Africa is the world region that is most affected by malaria. In 2015, the African continent held 9 out of 10 malaria victims. However, Africa is also the world region that has achieved most progress in mitigation of malaria.
All around Africa and beyond, wherever countries and whenever countries have put universal community-based primary health systems in place, the results have been good.
In the sub-Saharan Africa, malaria cases accounted at least 90% of the deaths. Rwanda particularly has shown unmatched political will to eradicate malaria by increasing volumes and reach of insecticide-treated mosquito nets, indoor residue spraying, accurate diagnosis and prompt treatment of artemisinin-based combination therapies, intermittent preventive treatment of pregnant women and more. The government of Rwanda, through the Ministry of Health in partnership with Society for Family Health Rwanda and with AC Johnson's funding, continue countrywide community sensitization programs of prevention and fight against malaria, simultaneously providing mosquito repellent products like Baygon coil and lotion. The executive director of SFH Rwanda, Manasseh Wandera, explains the introduction of health posts and the benefits to the Rwandan citizens.
I'm very excited about our partnership with the Ministry of Health and SC Johnson, especially in the fight against malaria. Of course, with SCJ, we have been partnering since 2 years ago. One is in the area of social behavior change communication, where we have targeted and massive education against malaria and other preventable diseases. So we have had our pilot in Kayonza, in the Eastern Province, working with Solar Kiosk and Coca-Cola, basically to teach people, to educate people on how to apply preventive mechanisms against malaria and other waterborne diseases. That has been successful. We have had research that has showed really tremendous results. Number two is in supporting the government of Rwanda through Rwanda Bureau of Standards by establishing the national-wide standards. And this is a great support to the government of Rwanda because it really contributes to safety. Number three, of course, like I said, is about the health posts. You see, with funding support from SCJ, we have now more than 10 health posts in the Eastern Province and in the Western Province. So this is really a success for us because each health post supports over 7,000 individuals, approximately 1,400 families. So basically, we see this as a total holistic support to accessing health.
A cross-section of citizens elaborate what these health posts have solved in terms of distance and healthcare service delivery. Before building the health post, we faced travel challenges, long distances to Katabagemu Health Center. There are some patients who refuse going there due to the long distances, and they became ill at home. Going to the health center is about 8 kilometers. We use taxi motors, 1,500 to go there and another 1,500 to come back. But after the health post was established here, no one gets ill. You get infected and come straight for treatment because it is not far. The health center at Katabagemu obviously has many patients, but here services are fast. You meet with the nurse right away and you get treated fast before you get ill and recover faster. Unlike the conventional methods, one of the nurses at the health post expounded on the additional prevention measures of applying mosquito repellents. This is also echoed by one of the patients at the health post. There were ordinary methods of malaria prevention, but there are places they couldn't be used, like farmers going to marshlands, night patrol. All those people can't use mosquito nets. The fact that they have been considered is a very good initiative. When you fetch water or walk at night, a mosquito can bite you, but as I use lotion, a mosquito can't infect me. The Executive Director of SFH, Mr. Wandera Manese, underscored the socio-economic impact of the health post and the need to install more for the citizens' welfare.
So most of the income they were getting, they used to use it for transportation for long distances. Now that money is saved. But most important, they have their health. Most important, they have their time, which time they are using to really generate resources and incomes for their families.
Nta munyarwanda ukwiye kwicwa na malaria.